Researchers across Ohio and Kentucky are gearing up now for one of the most comprehensive plans to ever address the opioid crisis gripping our nation. Some of it will happen right here in the tri-state. Yesterday, the Health and Services Secretary announced the University of Cincinnati is one of several colleges in Ohio looking at ways to improve treatment and also intervention. 9 on your side's Tamika Artis joins us live in the newsroom right now with the goal and the challenges of this plan. Tamika?
Yeah, Craig, the University of Cincinnati was awarded a $15 million grant to develop an evidence-based approach to tackling the problems of opioid addiction. The goal is to drastically reduce the number of deaths by 40% in 3 years.
We really want to work with the community partners to help think about what their needs are and then develop an action plan to implement pretty quickly.
It's a lofty goal, but Dr. Jennifer Brown with UC Health's Addiction Services is up for the challenge.
I like to think of ourselves as the leaders in addiction research.
Dr. Brown is one of a hand-selected group of researchers in 4 states who will be looking at evidence-based solutions to tackling the nation's opioid crisis.
If we have all first responders give out naloxone to treat opioid overdoses, does that make a better impact than having emergency rooms give out naloxone?
It's the first time that questions like that will be answered using scientific research.
The other part of this will be an opportunity for some new resources to help understand where things aren't working.
This is not a first for the university. In fact, they have been on the forefront of addiction research in perinatal and emergency room care that has been used across the country. Amy Parker, who runs the community outreach program for Brightview, says this research proves the country is moving in the right direction when it comes to saving lives.
I think that we're finally now realizing that there are more than one pathway to treatment. There are so many options for treatment nowadays. We've worked really hard for that. And so now it's time to start looking at the gaps.
All right, well, coming up at 6, Amy Parker, who you just heard from there from Brightview, will delve into some of the challenges that she hopes this new research will address, specifically dealing with certain groups of addicts that she says have been largely overlooked. Craig?